Welcome to our 541st Imagine Greater Buffalo program and our 163rd YouTube Imagine Buffalo video. Now, these have been hosted by the Buffalo and Erie County Public Library going back to 2009. Thank you for joining us today. This program is created by the Center for the Study of Art, Architecture, History, and Nature, or C-SAAHN, as I like to pronounce the acronym, and ImagineLifelongLearning.com. Before we get started, just a little housekeeping. Everyone watching will be muted and your video turned off. If you have a question or comment, please type it into the chat box and we'll go through them at the end of the presentation. Now, we are recording this program so you can watch it again later on the Downtown Central Library's Facebook page and YouTube channels, and certainly we hope you share the link with others. Now on to our featured speaker. Scott Scanlon, a Cheektowaga native, has worked in journalism in South Florida, Central New York, and Western New York for 38 years, including 10 as editor of Western New York Refresh, the Saturday section in the Buffalo News, which focuses on health, fitness, nutrition, and family life in the Buffalo Niagara region. He now serves as the Quality of Life and Solutions Journalism Editor at the Buffalo News. Now, Scott has reviewed the Robert Wood Johnson Foundation annual report for this series for the past several years. We hope he's got an updated report that is an improvement on previous years. We're going to find out. Scott, welcome and take it away.
Thank you very much, Dennis, and for Joy and Allison with the library system who are helping out today. And it will be hard, Dennis, and for the rest of you to give a comparison countywide in New York State as I have before, because the Population Health Center at the University of Wisconsin, who puts this data together with support by the Robert Wood Johnson Foundation, has decided not to rank counties across states and across the country, and instead has a new chart that I'll show you in a minute that kind of lets folks know roughly nationwide where their county stands, and then also compares it to counties that are in a similar boat where things go. But Joy, you can move to the next slide and we'll get into that. I would say that Erie County has been kind of middling in nationwide in these rankings, and that's because there are some other parts of the country that have some more significant problems, and there are regions within counties that have some significant problems, and regions within state. So the health state of Western New York, in a nutshell, is similar this year than it was last year and the year before. The health of Buffalo Niagara counties it is somewhat improved. And first, let me say that the data used in this latest report stretches back to 2019, and it tends to end in around 2022. Most of it between 2020 and 2022. So they add a year, sometimes 2 years at the back end, and so we're not looking at 2024 numbers. We're not looking at 2023 numbers. And we all remember what 2020 to 2022 was like with the pandemic. So take a look at those numbers with the numbers you're going to see with that in mind. So we continue the sense that I have, having taken a run through the numbers, we continue to be probably the least healthy region, Western New York and New York State. And here's what's measured when we talk about health. And they do a very detailed look with data from dozens, if not hundreds, of different sources that are kept by state and national and regional governments across the country. But stuff that involves birth and early childhood, infant mortality, mental and physical health, HIV rates, and also our health behaviors, which make up most of why a region and individuals uh, struggle with health challenges. Tobacco use, obesity, drinking, and sexually transmitted disease, teen births, and then some of the social determinants of health, um, income equality, children in poverty, educational status, and then the number of health providers in a region, in a county, and broadband rates, high school and graduation rates. These are some of the things that are measured here. And combined, they give these public health officials who are statisticians a sense of how things are going in particular regions. Next slide, please. And this one's getting cut off a little bit, but they look at health outcomes here, quality of life and what's available, length of life are kind of the two big health outcomes, right? Uh, the quality of years in your life are more important than the number of years in your life. And this is how they weigh things. So I want you to take a look at the second one down there, clinical care. That makes up 20% of out of 100 of health outcomes. And you think about that. We don't spend too much time at a health provider's office. So 80% is non-clinical care behavior, the physical environment, social factors, and those sorts of things. And within those behaviors, some of the ones we just talked about, the quality and access to care, which in Erie County is tremendous compared to a lot of counties in New York State and across the country. We have the care available in most cases, unless you or a loved one is struggling with a rare disease. But that is there. So that care is available when you're sick, when you need it. The other stuff, and maybe it depends on your zip code, your education, and some of those social determinants of health. So we've talked about that a little bit, those social and economic factors. And then the physical environment, housing, transportation, and the quality of our air and water. Next slide, please. And this is kind of an image that they use in the report that just talks about what are some of the key elements from a civic point of view that make a healthy community. And that's access to a grocery store in your neighborhood, broadband, the number and quality of libraries in a county, how active residents are in local government and in their school systems. Next slide, please. And this chart here gives an indication, and I think it's one of the more important charts that they have on the website. And the web address will be available at the end of the slide presentation. But the rankings are really looking at civic infrastructure and civic participation when they're examining the least and the healthiest communities in the region or in the country. And as you look at it in these areas, access to broadband, libraries, the access to parks and adequately funded schools, and social associations, the thing that help prevent isolation, no matter what age you are. Those issues, those areas tend to be weaker and potentially underfunded in what health factors, what health outcomes are shown to be less healthy communities. And I suppose you could argue that that may be the same for individuals within those communities. Next slide, please. It's kind of interesting that you can actually look at a map of the United States, look at health turnout, or I mean at voter turnout, and see that some of the areas where voter turnout is the lowest also tend to have the greatest health challenges. And you'll see here with dark purple being the higher turnout that Western New York is again kind of middling, maybe to low middling, and that the lowest voter turnout is in the southern tier, where health outcomes historically have been the most challenging. Next slide, please. And this is one of the quotes that I pulled out of the report that I thought was important. Evidence shows that participating in our communities, whether through volunteering or joining neighborhood groups, strengthens social connections and the sense of belonging, which in turn benefits our physical and mental health. Civic participation in political or electoral processes through voting or organizing can also influence policies that create opportunities for health, including safe spaces to live and work and funding for public health initiatives. Next slide, please. The healthiest counties where people live long and well tend to have a more accessible information environment. And we still, despite some of the challenges we have with folks transitioning from print media, like the Buffalo News, more to online, like buffalonews.com and social media, that access to factual news that provides a balanced view of what's happening in a community, its needs, that also offers more voices in terms of where the community is, where it should be going, and is less exclusionary. Those communities tend to be healthier. Just the opportunities, the accessibility to that. And here, the example in number 3, where there's less accessibility in the information environment, areas including the U.S.-Mexico border, within the Black Belt region, and we'll show you a map in a minute, in Appalachia, in Indian and Native tribal areas, these regions bear the legacy burden of various forms of disinvestment and structural racism. And it should probably be no surprise that these are the areas within counties and regions that struggle the most, generally, with health issues. And barriers to civic health can include barriers to voting. And this is the way they've come up over the last couple of years. This is all factored in to the health of a region. And life expectancy is on average more than 3 years shorter in counties with more structural barriers compared to those with fewer. And you can see the difference there, 3.5 years. And here's what I'd like to underline number 4, because that is also the case in our region. These findings illustrate that everyone's health is implicated when we exclude people and communities from participating. Next slide, please. So healthy communities depend on a culture where all people have the power to make change and a say in the decisions that affect them. And you can see American Indian territories, including in Western New York, have traditionally had longstanding types of structural racism and disinvestment. And these are areas where you saw from the previous map where there can be some challenges in terms of health outcomes and behaviors. Same with the Black Belt in the South, the Appalachian Belt, which stretches all the way into the southern tier in Western New York as well. Next slide, please. And broad access and accurate and timely information, as I said, supports thriving communities. News media outlets are important. Broadband internet access, which has become an important issue in New York State and in other parts of the country. And some of our federal lawmakers are trying to improve that in rural parts of New York. And then public libraries. Now, they can often be unevenly funded in not only within different cities or counties, but in regions. And rural regions where there are any number of challenges these days with population flight, transportation challenges, make it harder to fund to adequately fund public libraries. Next step, please, or slide, please. And then there's socioeconomic opportunities as well. And these all seem to line up with worse health outcomes and health behaviors. You can see that at least in much of Western New York, we're in reasonably good shape. But my eyes aren't what they used to be. I think Erie County, again, is one of those middling counties when it comes to socioeconomic opportunities. And some of the better areas in here are in New England and in the Midwest. And there's a little bit on the kind of the upper west as well. Next slide, please. So by the numbers, all 8 counties in Western New York fall below the average statewide age of 79.7, which fell by a year. Again, these are older numbers, so that mostly is due to the pandemic. The average life expectancy in Erie County is 2.2 years less than statewide. And for Blacks in Erie County, life expectancy is 71.1, more than 8.5 years less than the overall state average and 7.5 years less than for whites in the county. For some zip codes in Buffalo, mostly on the east side, one of the zip codes spills into Cheektowaga. I have heard folks who focus on this issue at UB and elsewhere say that the average length of life is about 12 years shorter than the county average. Next slide, please. And this is life expectancy in Erie County. Again, data from 2019 and to 21. I wanted to underline that in this slide. It shows the difference based on race in the county. And one thing I noted, I've not used the non-Hispanic Asian in this slide in the past, but we see this even kind of worldwide. People who live in many Asian countries have a mostly plant-based diet. They tend to exercise more, and the family structure can be a little bit different as well, with maybe a little bit more often, more than one generation of family members living together, for what that's worth. Next slide, please. Here are the health behaviors in Erie County, New York, and the US. And I've not put this in a slide previously either, but I think it bears seeing about how much we have as individuals in Erie County to do with our health outcomes countywide. Our smoking rates are higher than state in the US. Our obesity rates are higher. Our food environment index, so we've talked a lot about that since 5/14, and the racist mass shooting here on the east side is pretty good, but not on the east side. Physical activity, we're kind of right around the others. Access to exercise opportunities. We have tremendous access in Erie County to fitness year round, and more people need to take advantage of that. It was harder during the pandemic, but we're out of the pandemic now, and it would be nice to see people being more active in our communities. Excessive drinking, you can see, is a little bit higher, and that tends to create health challenges as well. Next slide, please. Erie County child and infant mortality, and I'll let you take a look at those. It shows the health inequality here, the health equity issue in Erie County, which is common in similar communities across the country. These numbers are pretty common, unfortunately, again, based on race. And that has to do not only with race, but economic opportunity, institutional racism, and all the things we have already talked about. What I will tell you is that the Buffalo News and the New York, Michigan Solutions Journalism Collaborative, of which the News is a member, has spent the last several years looking at caregiving, solutions-based stories. The news and other members in Detroit and Rochester and the Buffalo regions, media members, will, starting the second half of this year, switch to be involved mostly in health equity stories. The news is I'm going to be leading some reporters who are going to be focused on mental health, maternal health, and gun violence as a public health issue. These are challenges that are happening in Rochester and Detroit as well. And we decided as a collaborative that they deserve more solutions-based attention. So you'll be seeing more of that in the Buffalo media and starting in the second half of the year. Next slide, please. So teen births as well, some positive news in terms of them being down in the latest numbers. Preventable hospital stays are about the same. So we are making some progress. As Dennis often asks, we seem to be moving the needle a little bit. But these things take time and effort and commitment. Next slide, please. Physical and mental distress. In Erie County, 11% of adults reported experiencing poor physical health for almost 14 of those days, compared to 9% statewide and 10% nationally. We also are a little bit higher than those experiencing poor mental health than state and nationally. Again, this question, these survey results, they would have added a year, probably 2022 onto those. So we're still talking about the end of the pandemic. Next slide, please. Percentage under 18 in poverty. Those percentages as well are down from the previous report. And if you take a look, they're still higher based on race. And when you look at the number for those of Asian descent, Asian American descent, many of those are new immigrants who have come from Burma and other parts of Asia to escape poverty and violence. Next slide. So just in terms of life expectancy and longevity, this all sounds horrible, but we can be thankful we weren't born 120 years ago or more. Life expectancy was pretty poor back then. And even in 1950, the world average, and these are all world averages except for the first, 48 years old. The world average in 2022, which is actually that should say 2024 because I just looked it up over the weekend, is 79.74. That ranks 47th out of 210 or 201 countries across the world. So you can look at it as if the U.S. is fairly high, but we spend almost twice as much money on healthcare as any other nation in the world. So take a look at that, at what we get for it, number 47. For all that money when it comes to health outcomes and life expectancy. Next slide, please. And this is a repeat of what I've had last year, the last couple or 3 years. This is what wellness is all about. And I just urge people who take the time to step into this once a year to think about wellness as a journey and the individual responsibility of gathering the tools that we can to give ourselves the best possible prospects for a long and healthy life. And part of that, as is being stressed in these rankings, is to be civic-minded as we do it, be helpful, try to support, and maybe lead positive change when it comes to health and well-being in Erie County. Next slide. And we have improved. We have telehealth is much more widely available. The health insurance rates, people with health insurance in Erie County and New York State, far higher than in many states and other parts of the country. And the UB Jacobs School of Medicine has offered nutrition classes, and UB and other places are starting to look at health equity in a way that lifts all boats in this region and equalizes those as best as possible. Next slide, please. Fitness strengthens the region and opportunities are plentiful. They're even going to be doing exercise classes on the ice rink at Canal Side since you can't skate on it this time of year. And I think they're starting this week. Next slide, please. And get real about what counts and what's not. Try to look at life holistically with a balance that includes moderation and making the right choices most of the time. You can't live in Buffalo and not eat pizza and chicken wings, enjoy a good craft beer some of the time. It just shouldn't be happening at every meal or every day. Next slide, please. And what all of us can do for better health. So Global Wellness Day is Saturday, June 8th this year. There's the website if you're interested in that. But do what you can to contribute to that. And other things to consider every day: stop what you're doing and calm down. Take a deep breath and exhale. I wish I could do that more often as an editor at the Buffalo News. And smile, because in spite of everything, smiling makes you feel a little bit better. Next slide, please. Walk for an hour when you're frustrated. It really does help. Next slide, please. Drink more water. I just saw something before this that drinking water can fight fatigue and that malaise that we can sometimes get. And it also just makes us healthier overall. And we also, when you drink water, you drink less of not only carbonated drinks, but also alcohol. Next slide, please. And read reliable journalism. You would suspect me or expect me to encourage something like this. It really does make a difference. Next slide, please. And now the rest is up to you. Here's some helpful websites, and they'll be on on Facebook and on the recording for this as well. But countyhealthrankings.org. I encourage you to go on there. It's fairly intuitive, and the first page will allow you to click on a link to this year's report and really explore what things are possible when it comes to improving your health and, more importantly, your county's and region's health. And that's what I got.
Well, that's quite a bit. Scott, this community owes you a major thank you, because you spend the time to go ahead and go through this annual report and at least share your insights. I'm going to raise your pay grade a bit since this is the Imagine program. I can imagine giving you a different title. You're in charge in this title of what would you do if you oversaw the whole thing? What best recommendation to help people see that health and wellness is really starts with them? It doesn't start at the doctor's office. It doesn't start at the Buffalo Niagara Medical Campus. It doesn't start at UB. It starts with them. How would you help that culture develop if you were in charge of being able to do so educationally, libraries? How would you even imagine to get that message across?
I think I'm fortunate in that I'm just kind of the messenger in this situation, and there are a lot of efforts that take place. There's a lot of opportunities, and I will say one of my disappointments is there's been a great disconnect from the traditional or legacy media to a lot of people who could benefit from hearing that, hey, there's something going on, out at the Outer Harbor. There's a fitness class, at Canal Side, probably in one of the parks near your area. But I'm just grateful at this stage. I'm getting closer to retirement that a lot of folks have kind of locked into this. It's not always visible because we don't report a lot on it a lot, but there are tremendous efforts going on, not only on the east and west sides, but in other parts of the city to teach people to grow healthy food, either in a community garden or in their own garden. It's happening at schools. And in the poorest neighborhoods where this is needed most the efforts are even greater. And Feed More Western New York has been participating in that. I think a lot of the things are in place, and the big question is how do we plug more people into that? And one of the strategies people are taking, and this is a lesson for everybody, if this could be, what I would suggest, more people are listening to folks who are in unhealthy places, right? Whether it be communities or individually, they're listening to their needs. There's a lot of catching up that still needs to be done, but I've heard someone say just in the last few weeks, if you want to help people who are struggling, listen to what they need. They usually will tell you more than anybody else who thinks they might know what those folks need. And I'm seeing that culture shift, and I think that's part of why, while they're improving slowly, why some of these health outcomes are improving.
Well, we had people on just last week from the Community Foundation and M&T Bank basically say the same thing, that they're doing their best to learn the technique of listening to people themselves and hearing what they need versus telling them what they need.
Yeah, and I will say the community foundation is one of the major foundations here, and not the only one, who is now shifting towards looking at health equity and institutional racism and how we can address that. And unfortunately, it's taken a tragedy in some cases for people to look that way, but they're looking now, and so this is a pivotal time in the health of our overall region in city. The Health Foundation for Western and Central New York has also shifted toward looking more at health equity and breaking down some of these institutional racist barriers.
Oshai, much the same story. Let's see what we have for questions from our audience. Allison?
Yeah, we have two questions. The first one came in. Steve says, I hear several governors have turned down federal aid to expand Medicaid for low-income people. Can we assume New York State takes in federal aid to expand Medicaid?
Not only does it, but it welcomes it, and it it has the it has the second largest Medicaid program, New York State, in the country after California. And the distance between them two is not as large as what's based on population. So we are welcoming Medicaid money. It's making a difference. But one of the big questions is, and I'll say this in the office sometimes, it it takes more than throwing money at a problem to fix it. And I think the state is among other well-meaning states and individuals and foundations that, by listening, may end up creating better systems where there isn't as much waste. And I've been told by folks in Albany, I'm working on a master plan for aging, sorry, that's one of the areas we need to focus on as well. But the resources are here, but the need is great. And that's something that we're going to have to be, us baby boomers. I'm talking to maybe at least a couple or three of them, including myself here on this chat. But it's not going to be easy to support such a big group as we continue to age.
I've got a couple quick questions that came directly to me. Bob says, did the study include any indication of the effect of COVID, including COVID deaths in nursing homes during the years of study?
There have been that's not the mission really of these numbers. So there's not a lot of examination of the pandemic here. There are a lot of other folks who are doing that kind of work. They are more interested in the long-term health challenges in counties across the country for various reasons. The ones that we focused on, that I focused on in the slide presentation.
Okay, and then Peter asks or says, thanks for putting numbers to assumptions. Considering the importance of inequity in these stats, please comment on whether the best understanding comes from looking at regions, counties, neighborhoods, cities versus suburbs, or other political or cultural boundaries if the goal is to get better outcomes.
Yeah, and that's a very important point. And it suggests to me, and I've sat in on a couple of webinars as well with the county health ranking folks, that that's exactly why they've decided to focus on comparable counties, right? And these are just not just numbers in thin air. They want counties that are similar in size, scope, challenges to be measured against each other. And maybe next year I take a closer look at the numbers that way. And they also are offering solutions-based issues as part of what you can see on the website. And a lot of that involves programs that have worked in other regions. And so this is a solution-based approach as well. There's a lot of talk about things we've already done or at least started in Western New York, like complete streets, carpooling and ride shares. And when it comes to, as you were saying, when it comes to some of the challenges we have here, incentives for public transportation, inclusionary zoning and housing policies, rent regulation is one potential solution they've talked about, rural transportation services, for enriched housing, and tax financing for affordable housing in different areas. You can see as you go through some of what they focused on is there's a real concern about rental housing versus home ownership. If you saw the Buffalo News yesterday in the Buffalo Next section, there was a chart and a short story about how rental costs in Buffalo have gone up something like 35%. I might be a little off on that, but I think that's what I saw yesterday. But since 2017. And I mean, so through the pandemic, people in Buffalo are now paying higher rents than they are in just about any other city or region in the country in terms of the percentage increase. So they're looking to get behind all of that as well. Long-winded answer to a very good question.
Any others, Joy or Ellison?
I have one more. Could you repeat the health focus that the Buffalo News will undertake during the second half of the year?
Yeah, and it's because of some of the numbers that we've looked at over the years as well, and what people in Rochester, Buffalo, and Detroit have seen. We're interested in mental health here. I've written some stories with my colleague Jonathan Harris on those. It's a little harder to get to them with a smaller staff and myself mostly editing. But mental health will be one. Maternal health, we're looking, and that will look at prenatal health as well as birth and postpartum. And gun violence as a public health issue. I've written about that. The first story that I had was the weekend after the May 14th shooting, and we've had some other reporters working on that. There are other efforts in other regions that are trying to take some interesting approaches, and we want to be able to share those with our readers in our region.
Well, this program is hosted by the Buffalo and Erie County Public Library System. And I know they stand ready to be as helpful if suggestions come from you or others to the library. I'm sure they will listen if their resources can help with this. It's lifelong learning, we like to think, and that's what.
And Dennis, if I may say, our editor Sheila Rayam has already started doing some listening sessions in the city, and as we roll, we plan to do more because we want to hear things from the grassroots as well when it comes to what might or might not work.
Well, I hope you're working with the library to.
And we certainly will. We'd be happy to do a
place to
program
listen.
there.
It's a place to listen. Yeah. Good. Scott, thank you again. Well done. A lot of information and and they rearranged it for you to make it more interesting, I guess, to have to analyze. So thanks for your hard work to do so, and your good column that you do in between these annual visits. Life willing, we'll see you down the road with further improvements. How's that?
That
In
sounds
Western
good.
New York. Folks, thank you very much for joining us. Come back next week if you're able to. One of our most popular programs year in and year out will be next week rather, when we will be talking with Lori Owsley, the president of Gardens Buffalo Niagara. And she'll be showing us, giving us a preview of this summer's garden walk, not only here on the west side and east side, but throughout the region. She's the president of that organization. So join us if you can. That'll all be taking place. That weekend self-guided tours would be taking place towards the end of July. I'm Dennis Galucki. Be well and good day.